Hi, I'm Dr. Shubin. I'm with Community Pediatric Physicians at St. Joseph Hospital. I have a few questions that our patients sent to us over the Facebook, and I'll be happy to answer those for you. Uh, the first question I have is, can I give my 5-year-old over-the-counter cough medicine? Well, usually it depends on the medicine, of course. Some medicines are not good for children under certain ages, and this one of them would be dextromethorphan, which is an centrally acting cough suppressant. So those are not good for children of this age. And then otherwise, there's another whole big group of medicines called expectorants. They will loosen and increase secretion of the sputum, and these are good because they will help clear things from the bronchial tree. One of them is guaifenesin. This is the molecule, but they come under different brand names. These are okay, but as a pediatrician, I have the highest preference for natural cough remedies, which are honey. And if your child is by any chance allergic to honey, you can use agave syrup. These were shown in studies to be not inferior to any of the over-the-counter medicines that are out there. So our next question is a temporal or ear thermometer better for taking a 2-year-old's temperature? It's a great question, of course. Well, these both thermometers would use the same kind of technology. It's infrared technology, and from I looked up this question, and studies show that temporal thermometer actually is more accurate because sometimes the tip of the ear thermometer may be still cold and not as accurate. One thing I need to tell you about is that actually it depends what we call a fever, depending at the site of measurement. If we measure it in the rectum or in the ear, the fever would be 38 degrees Fahrenheit or Celsius or 100.4 degrees Fahrenheit. When it comes to temporal measurement or axillary measurement in the armpit, this temperature, what we call fever, is from zero point 0.5 to 1 degrees Fahrenheit lower. So fever in those locations, temporal, we call it a fever when it is exceeding 99.5 degrees Fahrenheit. Well, we'll move on to the next question. My wife and I are on a gluten-free diet. Is it okay for a child to also eat gluten-free? Well, this is an excellent question. If you and your wife are on a gluten-free diet, then this may mean two things to me. One is that you have celiac disease, and the answer is if your child also has celiac disease confirmed by laboratory tests, then he must be on a gluten-free diet. It's a must. There's another much larger group of people in the population. They're not allergic to gluten, but rather sensitive. There's no immunologic derangement, but they are sensitive when they're eating that, and they have symptoms still. In other words, it is absolutely safe for your child to be on a gluten-free diet. It does not interfere with growth and development. Okay, next question is, can infants get strep throat? Well, strep throat is a common pediatric condition. We know it is caused by a bug called Streptococcus pyogenes, or group A streptococcus. In older children, it has a very distinct clinical features that we can easily suspect. It's an abrupt onset of sore throat, fever. The bug is multiplying in the tonsils and in the pharynx and releasing toxin. And this toxin is causing all these symptoms of high fever, nausea, abdominal pain. There may be vomiting, and then there may be skin rash even. In that case, this would be called scarlet fever. However, the question is about a child of an infant age. Infants are children from 1 month of age to 1 year of age to 12 months of age. So specifically, interestingly enough, they still can get strep infection, but it will not be looking like in a child who is older, but the presentation may be different. They may be fussy, there may be a runny nose, with some secretions lasting for 2 or 3 weeks. They may have poor appetite, and in that instance, we would suspect streptococcal infection if the parents or anybody in the household or anybody who they contact with are known to be carriers or had strep throat infections in the past. We would just take a swab and send that swab to the laboratory and confirm this condition. In this age group, up to 3 years of age, the infection is called streptococcosis versus strep throat in older children. And finally, our last question. I am pregnant. How does my new baby become a patient? Well, if you have already made a choice that you will deliver at St. Joseph Hospital, we will be very happy to have your baby. Uh, there are two ways. One way is the sooner you choose your pediatrician, the less stressful it will be for you when the time comes. There's no pressure. You already made your choice. You can call our office and ask for meet and greet with the pediatrician appointment. We will be happy to assist you with this. Otherwise, if you are on the floor, already had your baby, and now is the time to choose your pediatrician. During that time, uh, doctors from our practice, myself and my partners, we round on the new babies, and you will be able to make your choice at that time if you prefer. Thank you very much for all your great questions. I am accepting new patients, and I'll be looking forward to meeting with you.